Should Juvederm be placed under the tear trough groove or in the groove? The photo on top illustrates the before placement of Juvederm. The bottom picture is after, 1 day. What could be done to get a smoother result?
Thank you for your question. You submitted two photos of before and after you underwent Juvederm injection under the eyes, and you're asking a question about achieving a smoother result. Well, certainly I can help you with some perspective from my practice. I'm a board-certified cosmetic surgeon and a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. And under-eye aesthetics, be it puffiness, hollowing, or both, is something we deal with in our practice every day. So I can certainly give you my perspective when it comes to the use of fillers to help with people who have under-eye hollows and puffiness. In the first photo, it is clear that you have lower eyelid fat prolapse. Now, of course, you've probably been made familiar with the fact that this means that fat around the eyes has bulged forward, and it has always been standard of care to address this issue surgically. Once the hyaluronic acid fillers came out, there was some room to soften that appearance, and certainly it is something we do in our practice. I would ask you to take a step back when you look at the aesthetics of how you appear after the procedure. You see, when we see patients, we often see patients who have had hyaluronic acid filler placed under their eyes, and when the fat pockets are beyond a certain threshold, then very often the amount of filler placed eventually makes the under eye area look very puffy. And the appearance right now with the photo, and of course it being 1 day afterwards, makes me see, when I see this photo, I see two areas of puffiness. And although that tear trough area has improved, the question you should ask yourself when you look at yourself is this the look that I want? When we do fillers in our practice for issues like this, we usually have our patients come back for reevaluation in about 2 weeks. And the reason is as follows. One is that when the injectable is placed, there's a certain amount of swelling that is a response to the actual trauma of placing a needle in the skin, even when done very delicately. Two is the material is placed, but it isn't fully settled or integrated into the tissue. So we allow 2 weeks to allow that process to occur. Hyaluronic acids also absorb water, and so there's a certain amount of fluid that can affect the final result. Now, it has been my philosophy, and although I don't have a side view photo of you, it has been my philosophy that if the fat pockets are beyond a certain level, even when there's relative under-eye hollowing manifested by volume loss in the tear trough, the eyelid cheek junction, and the malar or submalar areas, then we need to have a strategy. And in general, if the puffiness is beyond a certain threshold, you can't add enough filler to make it look good, because if the fat is already pushed so much forward that adding volume means making not only the tear trough area elevated, but also having to make the cheek elevated. There have been numerous patients in our practice who've come to us who we've used hyaluronidase to actually dissolve the material because their eyes got kind of lost in all of this material. I'm not saying that's the situation for you, and for your aesthetics this might be desirable. But when I counsel patients about this, I usually say, let's address the negative, which is the puffiness, and that is addressed surgically. Now, many people are very scared of surgery, but when they finally learn about the way we do our surgery, it's less daunting. We do our procedures under local anesthesia with light intravenous sedation in our own office operating facility. So it's not like going to a hospital, it's not like going under general anesthesia. So in so many ways, it actually compares similarly to having filler injection. And we definitively address the lower eyelid fat pocket. In a younger person, we do a procedure called transconjunctival blepharoplasty, which means there's no external incision, and we get very, very nice results that way. Now, I also counsel patients that if they need volume correction, well, it's so much more effective when you've addressed the fat prolapse, and you can be strategic about placement of filler in the tear trough, the eyelid cheek junction, and the submalar area. So I think that communicating with your doctor about your concern and probably waiting to allow it to settle before you add more filler, and then and of course explore the option of having lower eyelid blepharoplasty. I think that if you've been trying to get injectables to avoid surgery, you'll find that in the right hands and the right situation, the surgery can be not so scary as you may have initially thought. Many of our patients who have come to us with fear about lower eyelid surgery have said to me that if I knew it was that easy, I would have done it sooner. So, so meet with your doctor again about this. I think one day is a little early to make a judgment and a recommendation, but at least I hope that I was able to help you with some perspective on how to deal with what is primarily a lower eyelid fat prolapse issue. So I hope that was helpful. I wish you the best of luck, and thank you for your question.